Hi, it's Dr. Amp again. We're talking today about living with high blood pressure and high cholesterol. High blood pressure is a circumstance where the blood pressure in vessels is higher than it should be. There's new guidelines you may be aware of that now say that the goal for blood pressure for all of us is 120/80 or less. Stage 1 high blood pressure then is a blood pressure that's 130 to 139/80 to 89. Those two numbers represent the systolic number and the diastolic number. Stage 2 high blood pressure are those blood pressure measurements greater than 140/90. If you have 3 blood pressure measurements greater than 130/80, we may discuss with you certain things to lower that blood pressure as well as medications. The American Heart Association estimates that nearly half of all Americans over age 40 have high blood pressure. High blood pressure and high cholesterol have many complications, principally heart disease, kidney disease, atherosclerosis, coronary artery disease, and finally heart attack and stroke. High cholesterol is often misunderstood. Cholesterol is formed normally in the body. 75% of all cholesterol is made through the liver and other cells. Cholesterol is important for cellular membrane integrity as well as the production of some hormones. Like everything in life, too much of a good thing can be bad. Too much cholesterol can actually overwhelm the body's ability to eliminate it. So what it does then is it lays down in the arteries that feed the heart and the brain. Over time, cholesterol can then harden and cause the arteries to narrow over time, which can increase the risk of blood flow as well as increase the risk of heart attack and stroke. The first place we would begin in treating both high blood pressure and high cholesterol is diet and exercise. Diet is to engage in a low-fat, low-cholesterol diet, high in fruit and vegetables and lean meat. Exercise, according to the American Heart Association, is also stratified into moderate and vigorous. Moderate exercise is 150 minutes per week, approximately 20 minutes per day, 30 minutes over 5 days. Now, that can be simple walking, yoga, or stretching exercises constitute moderate exercise. For those of you who exercise more vigorously, the American Heart Association says 3 vigorous episodes per week of 25 minutes or more is adequate exercise. Vigorous exercise are things like jogging, swimming, and bicycling. We commonly get asked, what is aerobic exercise? Aerobic exercise are those activities that meaningfully increase your heart rate to increase your heart and lung function for greater optimization of oxygen use. Without adequate increase in heart rate, we do not see the benefits of aerobic activity. Smoking remains one of the greatest United States public health issues. Smoking constitutes about 1/3 of all cancers. 250 billion cigarettes are purchased per year. $300 billion is estimated cost lost on smoking conditions for either direct health costs or indirect health costs for those who are victims of passive smoking and its effects. Please talk to our office about stopping smoking. The quote of the day is treatment without prevention is simply unsustainable.